Yes, Jess, I'm at Accelerated Urgent Care here in Southwest Bakersfield. I'm going to give you guys an inside look at what you can expect if you are wanting to get testing done tomorrow. Now, what you'll actually start off doing is by going all the way to this side of the building. When you go down there, you will see healthcare officials, and they will be pre-screening people before they even come inside the building. Now, what they're looking for in these pre-screens are, do you have a temperature? They're going to ask you a series of questions. Have you traveled outside of Kern County the last 30 days? And various other questions, which will then lead you to this side of the building that we're on right now. Now, right here, there will be a second red tent, and at this red tent, they'll do another intake process. You'll get a wristband, and all through this process, you will be staying inside your car. Now, this intake process, when you're inside your car, they will notify you when you're inside your vehicle when you can actually enter the facility, and you'll be entering this door right here. So I want to take you guys and show you guys some of the rooms and what everything will look like. So you'll actually come through this hallway, and you can already see these chairs are already spread out. They're 6 feet apart already. And this is a brand new facility. No one or anything has ever been in here, and it smells just as new. And I'm actually joined here with Dr. Erickson in one of the rooms that you guys will be in if you plan to come to get testing. But here's the thing that people need to know. Just because you show up does not necessarily mean that you will get tested. So Dr. Erickson, can you tell everybody a little bit about the criteria and why you are doing such a pre-screening process when people come to your facility?
Sure. The screening process is really so we're utilizing all of our resources appropriately. So what we're looking for is fever, cough, shortness of breath. We're looking for travel to endemic areas or a history of someone that's being tested for COVID-19 positive and you were exposed to them. Those are the 5 criteria we're looking for, which allows us to sort of specifically use our swabs on people that need them. So we're not just testing every single person that comes through. We're screening them for appropriate tests. And if you have other things going on, we're also checking for that. If you have a sore throat, we're going to swab it. If we're worried about pneumonia, you're going to get a chest x-ray. We have x-ray on site, private hallways to get you there. So we're really trying to do a focused exam, so we're not just randomly screening everyone. We're screening the right people and utilizing our resources, because there is a limited number of nasal swabs. We're also doing a saliva test, so you can, clear your mouth out, and you kind of do this deep cough and bring up a sputum sample. We can use that as well. But if we use the nasal swab, I have one here with me, and they kind of look like this.
Yeah, and these are the tests that they're using across the nation right now.
This is there's different colored caps, but it's got this molecular assay in it, this pink fluid, and there's 3 little glass balls in there, and that's used to disperse the patient's sample. So we swab the nose, put the swab inside the liquid, and then we put the cap on. It goes in a vortex and spreads the virus into the liquid so we can get an accurate sample. So that's what Quest Labs will be doing. Quest Labs is doing almost all the testing here on the West Coast. So this is what we'll be using, and these we have a limited supply of these, so that's why we're being really focused on our result. As we run out of these, we will move into sputum testing, and we can do that in a sealed container, and we can do lots of those. So we feel like we're in a good position now to test everybody that we think needs testing. But again, people will be separated when they get here. We'll have 2 separate red tents, so people will either be directed to the urgent care if they don't have the specific COVID criteria, or they'll be directed to the COVID side if they have those 5 criteria we talked about.
And just one thing I want to jump back to before we get back into the rooms. Now, when people come, they're coming in their vehicles. They can stay in their vehicles and be processed in their vehicles.
Sure. Yeah, so when they come to, we'll call it red tent number 1, they'll come to tent 1, and then we'll say to them, okay, you have the criteria for the COVID. They'll go to red tent 2. You're going to get a wristband. You're going to get a number. We're going to give you some paperwork to fill out in your car. And then as you're filling out the paperwork, we'll send you a text when we're ready for you, because we don't want people congregating. That's the whole point to this. So people will stay in their car, we'll call them in. As soon as they're called in, they drop off their paperwork, we pull them into a room. So we're really trying to keep people separate. That's why we have a separate facility. And we think that's the best way to control the virus. As our viral curve sort of ramps up, we want to do everything we can to isolate people, social distance people, they keep saying. So we're taking this sort of abundance of caution, I've heard people say, which is kind of what we're thinking, to keep people apart, keep the spread at a minimum, and then give people an area to come in that's never had patients in it. So there's not heavy microbial surfaces in here. It's been clean top to bottom, and we feel like
you can smell the cleanliness. Yeah, it smells like brand new and clean.
And we're wiping it down with antimicrobial wipes throughout the day. We have hand soap in every room so people can wash and do their 20 seconds of hand washing before and after patients. So we've taken our time to get set up and be thorough so that people can have a clean, isolated testing experience and not go into, a big waiting room with 50 people that are all spreading the disease around.
Right. And I think one of the biggest questions, and I know we talked about this earlier, is people are worried about the cost and the insurance. Can you talk a little bit about the insurance part of this testing?
Sure. Yeah, insurance is covering it. So your Blue Shield, Blue Cross, Cigna, Aetna, Kern Family, they're all covering this test. So when people come in, they will not be paying for the test at all. Sometimes there's a copay, but there's no charge for the test. So. And as we develop legislation, it'll be covered for everyone. And so, but if you are insured right now, they have promised us you will be covered.
And as far as the respiratory testing, if you're coming in and you're getting those flu tests and all those pre-screenings, that should also be taken care of through insurance as well. Or people should check with their insurance provider.
Yeah, they've told us they're going to cover all care that surrounds the coronavirus. And part of the testing for coronavirus is ruling out flu. So an influenza swab will also be done, which should all be covered by insurance at this point.
And then I just want to talk a little bit about the stuff that you have here. I know you have some masks and some gown and all of that. Now, of course, we don't want people to be scared. We want them to know exactly what to expect. So a little bit about your protective gear, if you could just go over that quickly.
Sure. So this is what they call an N95. People have heard that term. It's a little more of an industrial-based mask. It has a little bit of a better seal around your face than a regular surgical mask. We use both. But when you put this on, it fits like this. And it kind of makes it a little bit more difficult to breathe. So I use both the surgical mask and the N95. If I'm really moving around, you start to get a little shorter breath in this mask. So then I'll switch to a surgical mask. So you don't have to have this. We'll be giving patients a regular surgical mask when they come in as well, which keeps their virus from being spewed out. So They both work. So this is an N95. This is the one a lot of healthcare workers will be using. We're also using gowns like this one here. So this gown goes on like so. And it ties in the back and it really protects. You can see it's pretty diffuse, protects the front body. We tie it in the back and we wear our face mask, and we'll also have goggles on as well. So you're pretty protected. And this is especially when we're going in for nasal swabs. That's really when it's critical. The front office staff will all have masks, but when we're coming in for the swab, you want to protect your clothing, your face, your eyes. The nose, mouth, and eyes are where the virus is really going to come in through.
Okay, perfect. Thank you so much. I appreciate it. All right, you guys, so Accelerated Health is going to be opening its doors tomorrow. And of course, you can find all this information on our website, turnto23.com, but they will be open tomorrow starting at 8 a.m. if you guys are interested in getting tested. But for now, reporting in Southwest Bakersfield, I'm Alex Bell for 23ABC News, connecting you.